town. And there wasn't any hospital when we were here. We just went door to door and asked for money. And anyway, we got enough money to start the hospital here. I know the first building that was built was the maternity wing. Think of how the town has grown, and think of what it meant, rather than having to go all the way into Toronto, or more likely all the way into Hamilton. Think of having everything right here.
With most people, they are so pleased with the care that they receive from the time they walk in the door. You get caring, compassionate people, a smile on their face, and what they bring is their heart, and it shows.
We want to be a front service organization. We want to be a leading edge hospital, but we want to be a caring hospital, and we're part of a caring community. Oakville is a wonderful town, and the folks in it give a lot of themselves, both in time and in financial support. And we want to make sure we give that back to them.
As a member of the community, it is important to have the service close to home, because we all have families, and we're all human beings, and potentially we can all get sick.
It was like I had a flu. One morning, when my mom came to wake me up, she couldn't really do it. She said I kind of looked through her when I actually opened my eyes.
She didn't hear me and didn't see me, and I just thought, what is going on? So I phoned 911, I phoned my husband, I phoned her doctor, and the ambulance came and brought her to Oakville.
She arrived by ambulance, and as you know, I'm the charge nurse, so I triage ambulances. And Sydney was sitting on the stretcher, acting bizarre, with a kind of screaming in a way that brought back memories from the 70s and 80s. As a matter of fact, I turned around and I said to the nurses behind me, if this was the 70s, this girl's got Reye syndrome. We put her into a room, and the physicians are starting to test her, and sure enough, she was taking aspirin the night before, and sure enough, some of her blood work is coming back to designate this is probably what the syndrome was.
The doctors at Sick Kids said that Oakville Hospital, if they hadn't have done those tests, she wouldn't have made it.
The one important thing for a patient is he has to have dialysis 3 times a week. There is no ifs and no buts. I always say this is the only place you can't phone up and say, I won't be there today.
An average person on dialysis spends about a half day, 3 times a week, being treated with a machine. Asking people to travel great distances to get life-saving care is not a reasonable thing.
Without donor support, they wouldn't get this service. And if they couldn't do it, then the question is, where would people like me get dialysis?
Many people don't realize that the government does not pay for all of the equipment costs. Most of the equipment comes from donations from our community.
Well, this is the hospital that they're going to come to if they call an ambulance. This is the hospital that's going to be providing the bulk of their health care service, should they choose to come here. And this is the hospital that they need to support.
The pain associated with trying to get air was incredible. I could feel my muscles pulling in my chest. I knew that this was the worst asthma attack I'd ever had. And if things didn't happen quickly, that I was going to die.
We arrived there, and Lynn was having an extremely difficult time breathing. She went from barely being able to talk to us to virtually being in respiratory arrest, and in fact her heart was failing as well.
The last thing I said was, you can't let me die. I have a child. And the last thing I heard before I arrested was, not on my shift.
Initially, we didn't think she was going to make it, but managed to resuscitate her very quickly. It was a wonderful team approach to see the docs, the nurses, and everybody else pitching in and supporting and actually saving Lynn's life.
An extra 5 minutes at that point in time would have been significant and could have been profoundly different outcome.
Had Lynn not been brought urgently to Oakville Hospital, Lynn most probably would have died. The spirit of the team that saved Lynn that day is a spirit that lingers throughout Oakville Hospital. It's a team approach of docs, nurses, and all other allied healthcare professionals working together to provide top quality care.
We have a wonderfully dedicated and committed staff. They will go the extra mile, they'll stay up all night, they'll come back after very few hours of sleep if their patients need it. They're available to us and to their patients, and we hear about it from the patients.
We have great nurses. We have wonderful doctors, a great team. But when we have good equipment to support them, their treatment options and diagnosis capabilities go through the roof.
You want the doctors to have the best equipment available in order to treat you and your illness, and it's our community. And that's part of being part of our community, is to support it.
If we didn't have the financial support of the community, we absolutely could not provide the excellent care that the community deserves and that we pride ourselves in delivering.
The machines here, the staff here, they need that money in order to do their job, and what they do is save people's lives every day.
They never know if they're going to use this hospital. And it's not just them. It's going to be their family and their friends and their neighbors. If there is an accident, an emergency, where is that ambulance going to take them? It's going to take them to this hospital.
We're so fortunate to be here, and we're so fortunate to have a facility of this quality in our town.
As a mom, it's what you want to be. You want to be there for your kids. And thanks to Oakville Hospital and Dr. Sapir and the ambulance attendants, I get to do that. And without them, the story might have been very different.